Hello there. Nice to meet you. My name is Dr. O, and welcome to the Ozone Medical Centre. I am a neurologist with over 15 years of experience in the medical field under my belt, and I understand that you know why you're here today. Yes, so you have been referred to me by your general practitioner or GP for a cranial nerve exam. My understanding, based on the referral letter I got from your doctor, is that you had a series of inconsistent and inconclusive magnetic resonance images, or MRIs, as well as computerized tomography scans, or CT scans. Yeah, they just came back a little bit inconclusive. So, my job here today is to perform said cranial nerve exam so that we rule out any abnormalities neurologically. Does that make sense? Yeah. So just so you know, and to fully explain today's process, we will be performing a series of non-invasive tests for our 12 cranial nerves. Yeah, we have 12 pairs of cranial nerves. They are your olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, Glossopharyngeal, vagus, accessory, and hypoglossal nerves. Sorry, a bit of a mind blank. Anyway, there's 12 nerves there that we will be assessing, and they are quite important for vital functions such as your sense of smell, eyesight and related eye reflexes, hearing or auditory acuity, speech formation. So essentially, let me know if there's any issues or if you would like me to explain anything in further detail. Otherwise, if you'd just like to take a seat, we can begin immediately. Excellent. Okay, thank you. Well, I'll just get my gloves on really quick while you get settled in. How's your day been so far? Yeah, pretty good. Excellent. Good to hear. Once again, I just want to reassure you that I've had many years of experience in this field, and today's tests are non-invasive, not painful. They don't involve any sharp tools or instruments, and you'll be done in roughly 15-20 minutes or so, depending on how fast we are. Yeah. Okay, is that okay? Excellent. Well, I've got my glove on for today. We'll just need one, and we're going to start with our olfactory nerve, which is essentially useful for our sense of smell. Now, I've got myself some jars filled with some non-invasive, non-triggering scents and aromas, such as coffee, vanilla, as well as lemon. So I've just got my little cup with each of them in it, separate cups of course. Now I'll just get you to close your eyes, cover your nostril one at a time. I'll ask you which one to cover. And we will be asking you to identify the smell in front of you. So if you can now close your eyes for me now. Thank you, no peeking. That's good. Okay, now I just want you to identify this smell in your right nostril. Coffee, yeah. Okay, and then this next one in the left nostril. Vanilla, correct. Now, let's put that one away. And this one in your right nostril. Excuse me. In your right nostril, yes. Very good. Yep, that is lemon. And then lastly, your left nostril once again. Coffee. Yeah, excellent. Okay, so that is all clear with our sense of smell. If there were some dramas with our sense of smell, that would be known as what's called anosmia, or the inability to detect smells. Anosmia. Yeah. Okay, so moving on to our optic nerve or visual cranial nerves. There are quite a few that are related to visual function and eye reflexes, most notably our oculomotor nerve, optic nerve, Abducens nerve, and Trochlear nerve. So cranial nerves 2, 3, 4, and 6. Yeah. So let's start by going over the main ones. Unfortunately, I don't have a Snellen chart with me today. A Snellen chart are those charts with the rows of letters that are slowly small and decreasing in size. They start off with like massive font and work their way down to like size 2 font. I don't have one of those. The optometrist across the road has unfortunately taken mine. However, we will be testing your other major functions related to these cranial nerves. I hope that is okay. It will still be able to understand if you are okay in this nerve department. So first off, with our smooth pursuit function, I'll get you to focus on the tip of this pen with your gaze. Now, if you could please follow this pen, keeping your head still, with your eyes, just horizontal movement. Good. Transitioning to vertical movement now. Excellent. Still maintaining your gaze on the pen. That's good. And then just in a diagonal fashion. Good. And out here. You're doing well. That's good. Excellent. Okay, have a breather. Not that that's too strenuous, but have a breather. Now we shall be trying to look at your saccadic rhythm. Saccadic rhythm, SACCADIC rhythm. So essentially it's testing moving from one point to the other quite quickly and accurately. Very important, most notably while you're driving, to make sure that you can identify hazards on the road. So you can imagine why we're testing it today. So quickly looking at this pen, to here, up here, down, from afar, up close, from afar, up close, over here, in the corner, and in front. Very good. So our smooth pursuit and saccadic rhythm are working very, very fine. Next, I'll just get you to focus on the pen in front of you. I'm going to put it quite close to your eyes, so much so that you're going to go cross-eyed. Yeah. So focusing on the gaze, on the tip of the pen rather, and then slowly coming out. Very good, very good, very good. And stopping there. Okay, perfect. And your eyes feel okay, no dizziness or headache, nothing like that. Perfect. Okay. Now I'll just get you to follow the pen now one more time, just checking for nystagmus or any shaking of the eye. That can indicate some issues with our cranial nerves. Yeah. Okay, that is good. No shaking of the eyes there. Yeah, I've yet to see one of those. They're quite rare, but it's always good to cross off the list in case there's any serious neurological pathology in our optic nerve or related nerves. Yeah. So that will do it for that one. Let's move on to cranial nerve number 5 now. So our trigeminal nerve. This is actually our biggest cranial nerve or pair of cranial nerves, and it splits into 3 different branches or branches. The ophthalmic nerve, mandibular nerve, and maxillary nerve. What the trigeminal nerve does is innervate some muscles and provide sensation to the front of the head or the face region. Yeah. So to begin with, I'll just be touching various parts on your face. I want you to tell me if you can feel them or not and answer my questions. So I'll just touch you somewhere else other than the face. So if you could close your eyes for this. Touching you on the here, yes, on your arm over here. If that feels like 100%, please let me know how it compares to touching you on your face. Yeah, okay, so close your eyes for me, no cheating. Just making sure, no peeking. I have to give you a blindfold otherwise. Some people do cheat. But, yeah, okay, so let's try touch here. 100% sensation, good. Here, same, here, and here. Okay, so 100% sensation in all of those areas. That is good. Now, does this feel the same as this? Yep, so touching your face in 2 different locations. Does that feel the same as that? Okay, that's good. That is good. Let me just jot that down in my notes. Have a little bit of a breather. You're doing really well so far. Next, I want to test your jaw, still part of the trigeminal nerve now. I want you to open your mouth like you're at the dentist almost. Yeah, nice and wide. Good, and then closing your jaw. Perfect, just like that. Now, we're going to do that process again, opening and closing the mouth, just with a bit of resistance from me this time, testing the strength in some of those facial muscles. So, yep, just holding a bit of resistance. Can you open your mouth? Good. Good. And then can you close your mouth? Yeah, I'm going to apply a bit of resistance just on the inside of your mouth there. Try not to crush my fingers and chew my fingers, please. Very good. Yep. And stop there. Perfect. Thanks for not chewing my fingers off. Okay, so that is good. That is our trigeminal nerve or cranial nerve number 5. Now we've already tested cranial nerve 6 or our abducens cranial nerve in our previous eye test. So we're skipping straight to cranial nerve 7, which is our facial nerve. Our facial nerve is a motor nerve, that is, it innervates the muscles in our face to perform their functions. So we'll be testing the facial muscles. So first one I'll get you to try to do is raise your eyebrows. This is testing our muscle known as frontalis. Front as in the front, frontalis. Yeah, that's the one you can see when you get all wrinkly when you do that. Yeah, so you can raise your eyebrows. Good, just like that. And then puffing your cheeks up nice and wide. Yep, like this. Good. Yeah, I know it's a bit silly, but they are legitimate things we need to try and test. There's a lot of muscles in your face. So now I want you to make a frowny face. Very good, just like that. And now let's see a smile. Can you smile for me? You have a very nice smile, by the way. That's good. And then closing your mouth. Okay, excellent. Next, I want you to squeeze your eyes shut quite forcibly, not just closing them, but squeezing them shut. Yeah, that's the way. And the other thing I'll get you to do, the final one for the facial cranial nerve, is to scrunch your nose, like so. Just scrunching your nose like that. Yeah, perfect. Okay, that's good. And you're not experiencing any pain or issues with those. Very good. Excellent. Well, time to move on to cranial nerve 8, or our vestibulocochlear nerve. Now, this nerve is quite important. Its function is to relay information from our inner ear into our brain. Very important functions, as you can imagine, for our hearing or our auditory acuity, as well as our balance. In our inner ear, we have what's called the vestibular system, vestibular, vestibular system, which contains some organs that are very tiny. Some of them are semicircle canals, some of them are otolithic organs, we call. And these little organs in our inner ear of our vestibular system are very important for balance and orientation. Yeah, it's where some people get like vertigo and extreme dizziness if there's issues with our vestibular system. One common issue we get with our vestibular system is BPPV, or benign paroxysmal positional vertigo, which is a form of vertigo. Anyway, back to the test. We're going to be doing a hearing test, so testing if you can hear from the front and then the back, like so. Yeah, very good. So can you, if you close your eyes for me, can you identify this sound? Yeah, just me scrunching my hands together, that's good. And then this sound, tapping my hands, or yeah, my fingers, yeah, that's good. And then again, in front, yeah, that's good. And then this one, tapping once again, very good. And once more, good. And then what's this? Front or back? Back, yep, good. Very well done. Our auditory acuity seems to be quite on point there, no dramas. Next, the second portion, our vestibulocochlear system, responsible for our balance, like I mentioned earlier. So we will, of course, be testing our balance. If you could please now stand on one foot. You seem like you're quite capable there. You're a bit active. So standing on one foot with your eyes closed. Just taking our visual field out of the equation, so we're relying purely on one of two of our extra balance systems there. So Now let's count down for 10, 9, 8, 7, 6, 7, 5, 4, 3, 2, 1. Okay, that's good. Very minimal swaying there, which is quite normal. Yeah, very minimum to nil swaying. Let's try it on your other foot now for me. Yep. I'm just here just in case you feel a bit unsteady, but I think you'll be okay. Now, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and opening your eyes there. Back to reality. Excellent. Are you feeling okay there? Very well done. Okay, so next that will clear our vestibulocochlear nerve or cranial nerve 8. Very good. Next, we will be looking at our glossopharyngeal nerve. So our glossopharyngeal nerve, we will be looking for sensation and some motor reflexes of the throat musculature. Yeah, so if you could please open your mouth for me, just want to have a look, make sure that our uvula is symmetrical and in midline. Yeah, our uvula is the little dangly thing in the back of our throat. Yeah, that's the one. Yep, just open your mouth a bit wider there. Perfect. Okay, so that's all clear. No dramas. Next, if you could repeat after me, just testing the tone of our throat. If you could say, the quick brown fox jumps over the lazy dog. The quick brown fox jumps over the lazy dog. Perfect. Okay, that sounds very good. Next, one thing that is also important is our swallowing function. So if our swallowing isn't okay, you can imagine the food or whatever it is can go down the wrong way. We don't want them to end up in our lungs. That is definitely where we don't want bacteria to go. We can result in pneumonias and things like that. So very important. I want you to, you've been talking to me quite well the whole time, so there shouldn't be a problem, but can you just do a bit of a swallow for me? Yep. Yeah, just like that. Swallowing your saliva. Yep. Perfect. Okie dokie. That is perfect. Right, so that is cranial nerve 9. Now, N10, sorry, yeah, vagus nerve 2. Yeah, so that included our glossopharyngeal and vagus nerve 9 and 10. Next up, we have cranial nerve 11, or our accessory nerve. This nerve innervates some muscles in our neck region, most notably our sternocleidomastoid, which is this thick muscle here, as well as our upper trapezius muscle fibers, which are part of our trapezius muscle. I'm sure you know the ones that sit on top here. Yeah, quite a popular area of tension and pain and distress. Yeah, so we're just going to test those muscles. Our sternocleidomastoid muscle, first of all, goes from here in our mastoid process behind your ear. You can actually feel it on yourself. And then it runs just down here, attaches into our sternum or our breastbone. Yeah, so it runs along there. Now, if you could please, by testing this muscle, look over your left and right shoulders for me. Yeah, that's good. So left and right. Just like that. Go for it. Excellent, just like that. And next, we're shrugging our shoulders up to our ears. Good. And that's for our upper trapezius muscle fibers. So, how does that feel? Good. We're just going to try that once more. I'm going to be applying a bit of resistance this time around to make it a bit harder for you. Yeah. So, shrugging your shoulders up. Good, and down, and one more time for me. Shrugging your shoulders up and down. Good. Okie dokie, perfect. Now, again, we're going to be looking over our left and our right shoulders. I just want you to do it against my resistance now. So I'll hold my hand up for a bit of a challenge. Good, using those muscles. Good, and then the other side. Perfect, okay. No strains in the neck when you did that. No dizziness or issues with feeling nauseous? No. Okay, that's good. Well, that is all fine. In fact, I don't need this one anymore. I'll take this off. Our accessory nerve is all in order. No dramas at all. So lastly, cranial nerve number 12, we've made it all the way to the end, is our hypoglossal nerve. So our hypoglossal nerve is responsible for innervating the intrinsic and extrinsic muscles of our tongue. So very important for speech formation as well as the quality of articulation when we speak. So I'll get you to repeat after me once more. The quick brown fox jumps over the lazy dog. The quick brown fox jumps over the lazy dog. The quick brown fox jumps over the lazy dog. Yes, perfect. Just includes every single letter of the alphabet, that little phrase, and you nailed it. Perfect. So, if I could just get you to poke your tongue out for me now. I know it's a bit strange, but again, testing our tongue, intrinsic and extrinsic muscles. Yep, just like that, poking your tongue out and then moving it rapidly side to side. Just like that. Very good, good coordination there as well. Perfect. So, lastly, I'll just get you to open your mouth nice and wide, saying ah, almost like you're at the dentist's office. Yep, similar to what we did before. Yeah, opening up and closing there. Okay, that's good. Sorry, I was just checking the tongue positioning, making sure that there's no issues there. So that's quite good actually. And that concludes all 12 of our cranial nerves. We've had a look at all of them and everything seems to be okay. There are no abnormalities detected, or NAD as we say in the medical world. I'll send a letter to your GP letting them know that the results of the test and that everything was fine. There's nothing to worry about. There might have been some issues with the scans, but it's good to know and be safe rather than sorry. Yeah. So you don't have to do anything else. You won't need a follow-up appointment with the neurologist, such as myself. Maybe just check in with your GP in another few months to make sure that there's no issues. And if you do notice some changes, please don't hesitate to see your GP immediately. Yeah, better safe than sorry, exactly. So, if you just like to walk out through that way and talk to Barbara, our receptionist, she'll be able to sort you out. And don't forget to sanitize on the way out. Yeah, definitely. Make sure you get in between the webs of your fingers. Yeah, perfect. Well, thank you for coming in. Once again, my name has been Dr. O at the Ozone Medical Clinic. If you enjoyed this video, please don't hesitate to leave a like if you did, and clicking the subscribe button as well as the notification bell to notify you of any future videos I upload. I hope you have a really, really good day, and I'll see you all in the next one.